Swimming was the first sport I fell in love with. Although it wasn't the first sport that I tried, I joined the middle school swim team after many failed attempts at being a basketball player. My dad wanted me to do basketball, but I was terrible at it. When I found swimming, I found a sport for me and me only. I found a sport that made me feel happy, that brought me friendships, teammates, and joy through moving my body. It was a sport that my dad knew nothing about, and he couldn't critique, or how he liked to say, coach me. Although there's a tremendous good with sports can also be dangerous. And today, I want to talk about an issue in youth sports, which is the lack of athletic training access. Back in high school, and with my fair share of rotator cuff injuries, my coach's mentality was always to just tough it out. He would say, if you didn't see the athletic trainer, you technically weren't injured. And so you might be asking, what is an athletic trainer, and why do I need them to participate in sports? To best explain what athletic training is, I like to tell a story of how I learned about athletic training. Like many athletes who are interested in the human body and medicine, when I started university, I thought I was going to be a physical therapist. I was at my honors college orientation, and we had a scavenger hunt, and our last task was to get to know campus, was to take a photo with a professor. With it being the week before classes starting, there weren't many professors around. But as any really competitive ex-athlete would be, I was determined to find a professor so that we could win that scavenger hunt. I found a random man in a suit on campus who turned out to be an associate dean for our college. This encounter was life-changing. He asked me about my major, my interest, and through that conversation, he told me about athletic training. I was sold. I was going to do athletic training. I had no idea that athletic trainers could not only provide rehabilitation, but also primary and emergency care. I went home that day and told my parents that I was going to change career paths because a random man in a suit on campus told me to. And as you can guess, that didn't go well. And so my parents had no idea what athletic training was. It was a career that doesn't even exist in Mexico. They thought I was going to be some type of coach, nurse, personal trainer. I took my losses and said I would move forward with physical therapy. A few weeks later, I saw the associate dean again on campus, and he asked me if I was getting my application ready for the athletic training program. And I said sadly, no, I'm not allowed to apply. My parents don't want me to. And so he was confused why I couldn't pursue my own educational path. I said jokingly and sadly, I can't disobey my parents, I'm Mexican. But what he did next really astounded me. He insisted to take me and my parents out to lunch, where him and his Spanish-speaking wife could ambush my parents through a conversation in Spanish of why it was important for me to pursue athletic training. And well, spoiler alert, I'm now a certified and licensed athletic trainer. I'm also proud to say I have my master's in public health and my PhD in kinesiology with an emphasis in biomechanics. My name is Dr. Mayrena Isamar Hernandez, and I'm an assistant professor in kinesiology and athletic training. I'm also the director of my research lab, which focuses on injury prevention and healthcare disparities. My upbringing, my background in sports, and my research on youth sport health equity all aims to shine light on a huge issue in youth sports today, which is the lack of athletic training access. And I want to take the time to tell you how to solve it. You see, often in healthcare, we don't get to see a doctor until an injury or illness occurs. Athletic trainers in the secondary school setting are in a unique and optimal position in public health to be able to, they're in a unique and optimal position in public health compared to other healthcare professionals. I want to talk about where athletic trainers are typically found. Although you can typically find us in pro sports and then also collegiate sports, we're also found in the military, industry, as well as even performing arts. But where I think athletic trainers really shine is the secondary school setting. Why is that? Well, with secondary school athletic trainers, we get to see our athletes before an injury occurs, during, and after. In public health, we see this as an upstream approach, meaning you're implementing the 3 levels of prevention, primary, secondary, and tertiary, to mitigate healthcare disparities against threats to health. Athletic trainers implement tertiary level prevention through returning an athlete to sport and their rehabilitation. Secondary level prevention through an accurate diagnosis and evaluation and diagnosis. and primary level prevention through pre-rehabilitation programs and knowing the signs and symptoms of a medical condition. And I think this is where athletic trainers really shine. You see, when I was a high school swimmer, my parents couldn't afford the time off work to take me to the doctor or get imaging done on my shoulder or take me to those physical therapy sessions. A solution to these barriers can be a secondary school athletic trainer. An athletic trainer right there in your high school can be a game changer. My research on secondary school athletic trainers demonstrated that it's critical for athletic trainers to be able to see the many reasons for injuries to even sudden death. This recognition of these reasons can be able to implement emergency action plans, which are detailed guidelines that allow us to not only do recognition, treatment, but also prevention and returning our athletes back to sport. Athletic trainers also in my study demonstrated that they were able to provide in-house care, such as free rehabilitation services in their athletic training facilities, having an accurate diagnosis for expediting the referral process, and as well as connecting their patients with many resources. Athletic trainers in my study also demonstrated that they had a great relationship with team physicians. This relationship with doctors allowed these doctors to see their patients of low socioeconomic status for free at sooner times and be able to provide equitable health care. Athletic trainers provided many resources to these patients of low socioeconomic status by providing public or state insurance applications, free reduced lunch applications, and then as well as language translation and refugee services, and even durable medical equipment like bracing and crutches. How did athletic trainers do this? Well, they didn't do it alone. They collaborated with many people, such as coaches, administrators, community stakeholders, local hospitals, and other healthcare professionals. Furthermore, athletic trainers in my study discussed that they had the ability to develop rapport with their patients because they saw them day in and day out in their high schools. Athletic trainers were able to implement patient-centered care, which allowed them to be able to build personalized care, continuous follow-up, especially for those that do not speak English as a first language or have difficulty with health literacy. However, unlike many professional organizations or collegiate teams, many high schools don't have access to athletic training services. According to the National Federation of State High School Associations, nearly 8 million children participated in youth sports in the 2022-2023 academic year. For previous research has also demonstrated that in communities, high schools with higher socioeconomic status have also had more athletic training access. According to the Athletic Training Locations and Services Project database, 66% of high schools in the United States have access to an athletic trainer. About half of those have access to part-time athletic trainers. That leaves 34% of high schools in the US without any access to athletic training services. All of these statistics show that despite millions of children participating in youth sports, youth sport safety is not a priority here in the United States. We cannot risk a child's life and well-being while participating in sports without appropriate medical care. According to the Children's Bill of Rights, developed by the Aspen Institute of Sport through its Project Play initiative, they state that children deserve to participate in sports in a safe and healthy environment. Program leaders and policymakers need to ensure that we're having these standards met for children participating in sports. One method to achieve this is to employ athletic trainers through lobbying for states to grant tax credits or incentives to hire at least one athletic trainer per high school. Another option that's really great is Team Heal, located in Los Angeles, California, Unified School Districts, where they've been able to hire at least one athletic trainer per high school in their underserved communities. In Hawaii, for instance, 91% of high schools in Hawaii have access to an athletic trainer due to their lobbying and advocacy process for hiring at least 2 athletic trainers per high school with the $4.28 million set aside for their public high schools. Because some athletic training coverage is better than none, telemedicine might be another option as well as utilizing applications like the Go4 app, which hires athletic trainers for game coverage at a set hourly or monthly rate. Program leaders, policymakers need to ensure that there are gold standard protocols in place when we're allowing our children to participate in sport. We cannot let our children participate in sports without that appropriate medical personnel. As a professor, I give homework, so here's your task. I want you to look up your local high school, club, or travel team and see if they have an athletic trainer. What's their name? Are they part-time or full-time? If your child, friend, family member were to participate in sports and get injured, would they have access to medical care? Do they know they have access? Because I didn't when I was a high school swimmer. Maybe your coach just simply didn't know what an athletic trainer could provide, from rehabilitation to life-saving measures. If you take anything from this talk, please understand that there are ways to prevent life-threatening injuries to life-changing injuries in youth sports. If we can increase access to athletic trainers, we can have more children have a positive youth sport experience like I did, one filled with joy, friendships, competition, and happiness through moving in your body. Let's make youth sports safe. Thank you.